Hey everyone, what's up? This is Dr. Charlie Johnson, physical therapist. Hope you are doing well. In this video, I want to kind of chat about this topic and resolve this question of, Dr. Charlie, do I need to strengthen my glutes to get out of pain? Very common question, and if you look around the interweb, you're going to see lots of people on YouTube, different places, talking about how weak glutes, inhibited glutes, dead glutes, they cause this pain, they cause that pain. And I'm here to tell you, you don't have to be so stressed out about this anymore, because we don't have any evidence to show that's really the problem, all right? And so, again, the intent of this video is to help you kind of calm your fears and or worries and or your questioning around, I've got these weak glutes, what do I do about it, and do I need to strengthen? Real quick before I dive into it, again, my name is Dr. Charlie. I'm a PT. I have my orthopedic board specialty. I teach people all around the world with back, butt, and sciatica problems how to fix themselves naturally using the power of their mind and movement as medicine. So do you need to strengthen your glutes and or your hips to get rid of your back, butt, or sciatica pain? Now, real quick, I'm going to refer you to another video. I'll link it or put it somewhere here, where I titled it, Stop Stretching, Start Strengthening. Now, I know everyone's looking for strengthening of the glutes videos, and so that title works, right? Catches your eye. But in all fairness, I think it's a little bit misleading, and the more and more I do this, I feel more strongly. So, all right, so what's happening? If you go to that video, you don't have to go to it now, but after this video, check that out, and read the comments. All right, read the comments below that video where I talk about strengthening the glutes, or as I also refer to as shortening the glutes. I think that's more of what's happening. Read the comments. Are people saying, hey, it took me months of strengthening my glutes to feel relief? Are they saying that? Or are they commenting underneath the video that, hey, man, I did that motion. Like, there was like immediate change, man. It was like immediate relief. Hallelujah. Praise the Lord. Or whatever you believe in, right? That's what people are saying. They are not saying, hey man, started this, and 3 months later, 8 weeks later, I'm getting better. That's not what they're saying. And so what's happening there? Well, I started to scratch my head and ask the same thing. I think what's happening is not strengthening. You're not going to see strength changes immediately. It's not going to take you 10 seconds, 20 seconds, a minute, 2 minutes, 5 minutes to see strength changes. And so if people are commenting that strengthening exercise, which by the way, would strengthen, so we're talking about clamshells, bridges, stuff like that. You'll see what I mean when you check out that video. Those things absolutely over time, your body going against gravity and or adding resistance to it will absolutely strengthen the hip muscles, the glute muscles. But that stuff takes time. It takes generally somewhere between 6 to 8 weeks and or longer to see true strength changes. Now you might see that people gain control quicker. We call this motor control improvements, right? So if you ever gone in the gym and you used dumbbells, at first, real shaky, right? And then the next week you're like, woohoo, I can do more weight. I'm stronger. No. Your nervous system just adapted to that input. It got better, right, at firing things the way that they needed to, quote unquote, fire. And fire is a bad word because your body's always firing different muscles. Your glutes, by the way, aren't dead. They're always turned on, all right? They're always working. If you stood up today, you went to the bathroom, you got off the toilet, you stepped out of bed, you're walking around, your glutes are working. They're functioning fine. Now, it is true that pain can inhibit function, meaning you can hurt your knee, and then you'll notice that pretty immediately your muscles around your knee don't work that well. But it doesn't necessarily change your strength right away. It's just that pain inhibits function. It makes sense. If you're in pain, you don't want to maybe move and or contract things as much as you normally would. So, hurt my shoulder a couple days ago, and I'm not weak, but I would say, ugh, it's a little yucky. And by the way, you go to the PT and they check your glute strength. They assess your glute strength when you're in pain. Well, if you were to check my shoulder strength when I had shoulder pain, guess what? I'd be like, hey, I don't even want to push that hard into your arm. I don't want to push into that device which is going to measure my strength. So of course, right, it's going to show that I'm weak. but it could just be that I hurt. And so if somebody's there checking your leg strength, they're pushing down your hips and say, oh, see how weak that side is? And like, wow, I can definitely tell I'm weaker. No, you're probably not weaker. You're probably just in pain. Because you're in pain, well, guess what? You don't want to produce as much force. Your brain says, hey, there's a lack of safety in that area. And so can I protect it? Let me guard? All those things. So again, these people are making these comments rather immediately. If you watch that video again, you'll see that. And so how is it, Charlie? People are doing these strengthening exercises and they're getting like immediate changes. Well, I just proved to you and or share with you, if you don't believe me, you can look it up, right? That strengthening doesn't happen immediately. So if you're getting an immediate change by doing a strengthening exercise, like a bridge or a clamshell or a leg raise or this or a squat or anything, there's millions of ways to strengthen things. Then guess what? It's probably not strengthening that's making the change, because strength takes time to change. All right? If you're getting an immediate change, it's something else. What is it? I don't exactly know, but probably we're fiddling with the nervous system. We're probably doing things that just feel good to the nervous system. And if we know that the brain is the CEO and sort of the creator of the pain experience, determines how much, regardless of the cause, pain you experience or feel, then how could we add some static to the system? How could we instill a sense of more safety versus threat? And I see movement as a way to do that. I see movement as a way you can create good inputs, which make you feel safe. And then the more you feel safe when you move, the less fearful you become of movement. And the less fearful you become of movement, the more you want to move, etc. And I think that's really what's happening. And here's the other thing. Like when I created that video, the logic was really simple. It was just that I was having everyone lengthen. I mentioned the shortening aspect earlier. I was having everybody lengthen their piriformis, right? This is the old school way of doing it. Everyone tells you, hey, pull on that bad boy, lengthen it. And then that was resulting in a lot of people having more pain and things not working. So then the logic in me was like, well, what's the opposite of not working? Well, working. What's the opposite of lengthening? Well, shortening. So what if instead of doing this, what if I did this? And I loosened it up in the form of like a clamshell or something like that. Literally, I just used this kind of law of opposites to figure it out. It had nothing to do with like, I wonder if I'm strengthening it or doing this or doing that. It was just like one input on this end of the spectrum, lengthening, is giving me a not good result. And the opposite of not good is good. And so the opposite of lengthening is shortening. And so I think it's more about just finding the movement or the input that works for you. And so I tell lots of people, hey, you're just one motion away. And people are like, what do you mean just one motion away? And I'm like, yeah, you're probably just one motion away. Think of movements and or activities that you're doing. If you're looking online, you're like, hey, I wonder if I need to strengthen the glutes. You probably don't. But regardless, it doesn't mean that a strengthening exercise, if you want to call it that, or if it's labeled as that, is working for the reasons that you've been led to believe it's working. And so many people are out there. I see this every day. I got a message from a woman the other day. She's like, hey, Charlie, I'm strengthening my glutes. I know that's what I need to do because my so-and-so said it was weak. More stuff. That probably isn't true. But it's really hurting me. How do I strengthen my glutes if it really hurts me? That's what I have to do, but it hurts. And so just this belief that she bought into made her continue to strengthen her glutes even though it was hurting. And I was like, stop. Don't do it. If it's hurting you, and if strengthening your glutes was something that was going to help you, then it wouldn't be making you worse. But that's what I need to do. So break your belief system right now. You don't need to strengthen your glutes, more likely than not, to resolve your pain. And again, this comes as evidence with just a lot of experience. This is obviously my opinion. But if you had a time in your life where you weren't strengthening your glutes and you had no pain, then why now all of a sudden do you feel like you need to strengthen your glutes? Just because you do have pain and you're looking for a reason? Lots of people, again, comment under that video that I talked about or that I'm referencing to. And they're like, wow, man, immediately better. Amazing. Thank you. I needed to strengthen this whole time. It's like, no. If you got immediate results, you didn't change any strength. You just did the opposite of that which wasn't working. You just gave the opposite input. Righty, tighty. Lefty, loosey. You were going right. You were trying to stretch this thing out. But for every action, there's an equal and opposite reaction. The harder you try to stretch something, guess what? The more it wants to fight back. The more you pull on something, the more it wants to recoil. And so you were trying to lengthen this thing, it wasn't working. And so I just said, hey, why not just do the opposite? And whether it was some, we call neurophysiological effect, did something to the nervous system, or it just made you feel good with motion. It was maybe the first time that you did a PT exercise and it didn't hurt. And so therefore it allowed you to buy in with more conviction and belief that it would work. And that's why it worked. Look, there's lots of stuff going on here. And again, we just don't always know the answers. And so drop this idea of you need to strengthen your glutes. You need to stretch the front of your hips and strengthen the back of your hips, because the front is tight and the back is loose and weak and lengthened and shortened and this and that. And just do what feels good. If a strengthening move feels good, by the way, how do you know it feels good? Well, I don't think I need to tell you that. It doesn't hurt. It's a yummy motion, right? And allows you to move better after doing it immediately, then awesome. If it doesn't, I don't care what anybody says. If anything I've said, right, makes you feel worse, don't do it. Which is why I just don't throw out blanket like top 3 exercises for back pain. It's going to be different for everyone, right? Listen to your body. Don't buy into the belief that you have to strengthen anything necessarily to get better. Realize that things work for more reasons than we probably know of and are aware of, and for more reasons than you've been told. So does core strengthening help people? Sure, it helps some people, makes some people worse. Does it work because you're strengthening your core? We have evidence to actually show no. It's just a good input. It allows you to feel more safe. And could that be the reason that these strengthening exercises or any of these things, any motion out there, any treatment works? It just allows you to feel good. It allows you to feel safe. And when you're guarded, right, because you're in pain, well, pain inhibits function. It makes you feel weak. And so the assessments are flawed right from the beginning. You go to someone, you have butt pain, and then they check your butt strength. Well, of course it's not very quote-unquote strong. You're going to not want to activate the butt cheek muscle if the butt cheek hurts, right? Or if there's a problem, which there usually is, or irritation with the sciatic nerve, well, the sciatic nerve is like the thing which allows your butt cheek muscles to work or not work. You cut that nerve, nothing's going to work. And so if you irritate the very thing which plugs into and or gives juice to the muscles of the butt, the back, the leg, all that, and you try to assess the function of those things, well, guess what? They're not going to be as sharp. They're not going to work as well. And we take that as, oh, see, your hip is weak. And then an evaluation instills that belief in you. And because of that, you buy into it and you try to strengthen your glutes. And you're just like banging your head against a wall, right? I'm strengthening my glutes. I'm doing everything I should, and it's just not working. Because you're not listening to your body. Because the assessment was flawed to begin with. And of course things are quote unquote weak because you're in pain. Then you're not getting anywhere. All right? So realize that pain is an experience. It's not caused by muscle weakness or muscle strength or tightness or looseness. There's lots of people who are really stiff and feel no pain. There's lots of people who wiggle around a whole lot, are really flexible, and have all the pain in the world. There's lots of people who are weak and feel nothing. There's lots of people who are strong who feel everything. All right? And so we can't really approach it like that. We can't just look at the mechanics of things and say you're weak and that's why you hurt. All right? So if you're strengthening lots of stuff and it's not working, you've got to change. You've got to break the belief that weak glutes equal pain, because they don't. There's lots of people walking around with flappy glutes and no pain. All right, just again, like there are strong glutes and lots of pain. And so realize too that in my experience, the changes that we see from doing different strength maneuvers, if you will, to the hip, to the back, to the whatever, are not due to actual strength changes. Strength changes don't happen within 5 minutes. And so why is that people are reaching out if they're doing a certain hip strengthening move and saying, Charlie, that was amazing, thank you. We couldn't have possibly changed strength that quickly. What did we do? We gave a yummy input. We gave the opposite input. They were trying to stretch it all day, and we said, hey, why don't you go the opposite? Instead of lengthening, why don't we try shortening it? And guess what? We got the opposite reaction. It's so much more about like logic and reasoning and the thought behind why we do things than actually what we do. All right, hopefully this was useful, and hopefully you pulled a couple nuggets. Again, just wanted to share this, rambled a little bit, but either way, pull the nuggets, apply them to your situation. Let me know if you guys need any help. Let me know your thoughts in the comments. And again, if you're curious about learning a little bit about maybe what's going on, maybe you're like, hey dude, I'm watching this, and like, yeah, my butt cheek hurts, but could it be my back? Could it be this? Could it be that? Maybe you're barking up the wrong tree. Maybe you're barking up the wrong tree, right? Go ahead and check out my DIY diagnostic guide. I'll link that above. Lays out my entire diagnostic algorithm for helping you figure out, do you have back, butt, sciatica problems, and what are they caused by? What's the most likely source and or driver of your symptoms? Will save you guys a lot of time, energy, and money. The goal is that you don't have to rely on other people to try to fix this and or figure this out. MRIs, x-rays, specialists, all this stuff. It's your pain experience. You can lean into it. And with the right tools, with the right guidance, you can absolutely figure it out and solve it. So I'm here to coach you through it. All right. Thanks so much. Chat soon.